Fire, Google, or Apple TV, you can watch ABC 11 24/7 with the ABC 11 North Carolina streaming channel.
This morning, Eyewitness News is taking your pressing health questions straight to the experts. Joining us now is family physician Dr. Alexa Mieses Malchuk. Dr. Alexa, good to talk to you again. Let's start with a new way to get COVID treatment. Walgreens is going to start a free home delivery program for Paxlovid. What might this do to help people battling the virus?
I think it's great anytime a pharmacy can increase access to medications for the people that it serves, but I also want this to serve as a reminder for the reasons why we would prescribe Paxlovid in the first place. So Paxlovid is not just for anybody who tests positive for COVID. It's really for folks who test positive for COVID and are at high risk for complications. Those risk factors include chronic diseases like high blood pressure, diabetes, having a suppressed immune system from, say, chemotherapy or an immunosuppressive drug. And then, of course, if you're not vaccinated, that too is a risk factor for complications from COVID. And the reason why it's important to only take it when necessary is because, like any medication, Paxlovid has side effects, but its benefit is that it can lower the risk of hospitalization and death. So if you've tested positive for COVID, speak with your family physician as soon as you can to see if Paxlovid's for you, and then it sounds like you can have a pharmacy deliver it straight to your home.
All right. Well, let's turn now to a new study that really has my attention. It says that you may only need 8 minutes of exercise a day. What can you tell us about that?
Yes, this is a new study that was published in a European journal that found that 8 minutes of vigorous exercise each day lowered the risk of cardiovascular disease and early death. But, let's not all get too excited here and think that, we don't need to exercise that much anymore. In fact, there are a lot of benefits to exercise, which include improvement in mood and sleep, appetite, even in cognition and the way in which we think and remember things. And exercise can even help stave off diseases like osteoporosis and improve bone health. And in order to get those benefits, you absolutely need more than 8 minutes a day. So despite the findings of this research study, I'm still recommending that folks get 20 to 30 minutes of moderate exercise every day of the week.
All right. Well, it was sounding pretty good there for a while, but thank you, Dr. Alexa. Well, many folks have pets at home and we love them dearly, but some new research says they actually may help with childhood development. Can you tell us about that?
Yes, so pets are amazing. I have 3 lovable pets at home as well, and we know that there are a lot of adults who use pets for emotional support animals or even service animals, but there is growing research that pets can help children who have neurodivergent conditions like autism. Now, with autism, the way in which children process social and emotional connections can be a little bit different. And there is research that shows that pets can lower social anxiety in these children and can increase brain activity that's related to social and emotional connection. So the research isn't strong enough for me to be able to write a prescription for pet ownership, but certainly if you have a child with a neurodivergent condition like autism, getting a pet is something that you may consider as a family.
Very good. Family physician Dr. Alexa Mieses Malchuk, thanks once more and have a good day.
Thanks for having me. Take care.